Hello everyone, my name is Owen O'Doherty. Welcome to Carefolk's headquarters in Cork. It's a real pleasure to be able to speak to you today and give you some insight into the work that we're doing at Carefolk. And in light of the recent publication of the HSE's Winter Plan and Budget 2020, I'd like to speak to you about Carefolk in an Irish context. So rather than the acute system being the first referral point, there instead would be a network of integrated teams and community hubs delivering an alternative care pathway. However, obstacles remain that prevent this vision from being realised. Teams are operating in information silos with little visibility over patient information at the point of care, and that doesn't work in the community. Workflows and assessments are still mostly manual and very inefficient, and education and self-management support for patients in the home and their families is underserved. So what is needed to remove these obstacles and fully realise this vision for Ireland? Well, number one, we need a technology stack and architecture that can enable the creation of community health networks and multiple teams and handle all of the compliance and security aspects around that. Number two, we need technology-enabled digitized workflows for care teams that allows the coordination of care around one shared care record at the point of care, regardless of where that point of care is. And number three, we need an easy-to-use next-generation support platform for patients and their families. And COVID has added a fourth. Healthcare staff need to be able to triage and assess and manage caseloads virtually without face-to-face contact in order to keep them healthy, reduce transmission and keep our health system running. So with Carefolk, we've developed the solution. We've developed an integrated care platform, which is web, mobile, cloud services, analytics, and an architecture that delivers community-based care. Teams can manage and coordinate care around one shared care record, available at the point of care with real-time information. Carefolk's analytics capability allows management on a regional or a national level to make better decisions based on real-time data gathered in real time rather than using retrospective data, which is often the case at the moment and manually collected. And the impact has been fairly stunning. The figures you see here are from independent surveys that are done by the Health Innovation Hub Ireland, all the HSE clinical teams using Carefolk. It has resulted, through the use of the platform, in a saving in the area of 10 hours per week per clinician, with 3 times the number of patients being cared for, using greatly improved process flow and case management. And of course, that frees up healthcare workers to spend time doing what they do best, which is caring for the patient and delivering better health outcomes. The last comment you see here, what we're using now is only a taste of the potential Carefolk has to offer, is very, very true. If you extrapolate these gains out across the health system, just imagine the cumulative impact. There has been a big increase in the budget for recruitment in the health service, which is right and correct. But imagine also the impact of releasing the massive untapped potential that already exists by simply giving teams the tailored tools that they need. It is a fraction of the cost, of course, and its impact accumulates exponentially. Of course, all of this is built upon a secure, mature, multi-domain architecture that we've been shipping for 5 years and which allows the creation of a community of teams and community hubs on a regional and national basis. We've always understood from the outset that this needs to occur, and we've developed Carefolk and aligned our product roadmap to meet those standards and expectations. Of course, COVID has accelerated the adoption of technology and innovation in the Irish Health Service, and the HSE's efforts in digital transformation and the Office of the Chief Information Officer and those driving it on the business side deserve great credit for that. To deliver the implementation of Integratedcare, it is very important now that there is no easing off in that momentum. Under the HSE's winter plan and the budget published 2 weeks ago, there's been quite rightly a massive increase in investment in healthcare in Ireland, including e-health. It is an investment on behalf of the Irish people, for the Irish people. And Peter Drucker once said, efficiency is doing things right, effectiveness is doing the right things. As an Irish company, we're deeply proud to support our healthcare teams and frontline workers, enabling them to do the right things right for those that they have a duty of care for. So with that, I would just like to say thank you very much. It's been great to speak to you today. We always welcome people to reach out and contact us if they wish to, and you can do so at these contact details. For now, thank you for listening, and stay healthy and stay safe, everyone.